So good morning, I'm Gloria Zans with the Innovation Learning Network. We are very excited to share today's Exponential Tech Tuesday, Social Networks in Healthcare. This is not your parents' Facebook, and ILN Exponential Tech Tuesday series. So do you remember back in the day with MySpace, AOL chat rooms? Well, those are two platforms that were iconic for their time. They really ushered in the concept of a digital social network. Well, today we use social networks for every aspect of our lives, be it LinkedIn, Twitter, Instagram, Facebook, or neighborhood-based apps like we have here called Nextdoor. We really have created a digital twins of our existing networks. So in healthcare, we've used patient communities for years. However, we're just starting to tap into the exponential power of social networks. So that's why we chose this topic for this month. We have brought together and curated a group of experts on this topic to share and disrupt your existing concept of social networks in healthcare. So before we get started, I want to run through a few housekeeping items. First, you have been muted upon entry to avoid background noise and disruptions. If you are joining us by phone only and wish to chime in during Q&A, please press *6 to take yourself off of mute. And we will hold off on Q&A until the end. However, please feel free to use the chat box during the presentation for questions and comments, and make sure that you select everyone from the drop-down menu. And last, this presentation is a contribution to the ILN, which means that you can live tweet throughout. We've actually dropped the session social media handles and hashtags in the chat room already, so please feel free to use those. Now, let me introduce our presenters today. We have Tom van de Belt, who is the Assistant Professor of Digital Health at Radboudumc REshape Center. He will give us a general overview of social networks. We also have Bart Timmers, who is a general practitioner, a member of online Twitter consultation, and he's going to share with us use cases in healthcare. Then we have Lee Ace, who is the director of Mayo Clinic Social Media Network. He's going to talk about relevance of social networks in healthcare institutions and what they're doing with social networks at Mayo Clinic. And last, we will wrap up with Wael Hassan, who is an entrepreneur developing big data solutions that link social media data with health systems, government, and energy data. So with that, I'm going to hand today's session off to Tom to get us started. So Tom?
Yes, just give me a second. Is it there?
We can see it. It's here.
Great. Yes, thank you, Gloria, for your introduction. It's a great honor to be here and to share my knowledge about and experiences about social media in healthcare. Well, let's start. We all share everything online, or at least that's what a lot of people do. And I always remember my sister saying, I've got 500 friends on Facebook. And I was laughing and I said, what the F? I mean, how do you really consider them as friends? Because I have 10 real friends. But then we had a very intense debate, and it turned out I really had to admit that she knew more about those friends than I knew about my real life friends. At least she had more actual information. So that really shows the power of social media. Well, there's more. Researchers found that if you use all the data we share online, you can predict when someone will get a divorce, or when someone will fall in love with someone else, even before they know it themselves. And there's more. Based on Facebook data, you can really learn a lot about your political preferences. And this is another interesting one. And like I said, this is all science, so it's based on facts. If you study Instagram photos, and particularly the filters people use, then you can really identify people who are at risk for committing suicide or develop a depression. Social media, that's just the interactive web, also known as Web 2.0. And in the past, it was a very boring web where a user could just, download stuff, text, photos, videos, and somewhere around 2008, the web, based on new technologies, turned into an interactive web with a lot of user-generated content. And that's when the social networks showed up. We've seen the same in healthcare. In the upper left, you see a doctor, can also be a healthcare institution. And in the past, the doctor would just share information with the patient and the patient would just receive it. They're miles apart. Well, in Web 2.0, they use social media to communicate, to share information. They become more equal partners. And we foresee, it's already happening, that this will turn into a network where different stakeholders are equal partners and efficiently share information. If you look at the size of social media, we all know that Facebook is the biggest one with over 2 billion users. And if you compare them to the top 3 countries based on the population, there's China, a little bit smaller than YouTube. India, somewhat smaller than Facebook Messenger, and the United States of America would be between Twitter and LinkedIn. And of course, the Netherlands, we are the tiny red line in the lower right, just a few pixels wide, with 17 million inhabitants. And I think this figure shows that social media are massive, they're global, they're much bigger than most countries. Well, you can best summarize them with the 4 C's. I think I've already discussed them. You can connect, consume, create, and control. And the last one, that one's very important for healthcare because people can share information, can share stuff, give kudos, and also like things so they can create value. It's also important to recognize that the majority of all the people on social media are just lurkers or spectators. They're not very active. They don't contribute a lot. And we have, let's say, about 10% that will sometimes like a blog or share a post. And there's only 1% that can be considered as a heavy contributor. And that's not much. But if you look at, for instance, Wikipedia, we know that only 1 or 2 in every 1,000 people will actually contribute to content, to Wikipedia pages. Well, with social media, things can go fast. Where it took 38 years for radio to reach 50 million users, with social media like Facebook and Instagram, social networks, we're talking about years or months. And with some of the, let's say, popular smartphone games that were shared via social networks, we're talking about days to reach 50 million users. And with the last one, what's the name again? Where you had to walk around and find Pokemons, that's the word. It was only something like 2 weeks to reach 50 million users. Well, how can healthcare benefit from social media? I would like to discuss a few, let's say, best practices for patients, doctors, or healthcare institutions, and for healthcare researchers. To start with the patients, you should know that more than 1/3 of all the people in the United States already use social media to manage their health. And with managing, we mean looking up information, sharing information with peer patients or with healthcare professionals. But there's more. We have a lot of e-patients. This is a very famous one, e-patient Dave. And he is convinced that he is still alive because of social networks. He had a very rare disease, a very rare form of cancer, and by consulting his peer patients and doctors around the globe, yeah, they found treatment. They found the right treatment options. He never said that his doctors did a bad job. He just wants to help. So he always says, let patients help. He also published a great essay in the British Medical Journal. Yeah, it's definitely worth reading it. Well, we all know patients like me, where patients can not only connect and share information, but they can also share their data for the good, for research. There's also iodine, where you can learn about medication, and this is very interesting for new patients because you learn about side effects and yeah, experiences with medication. And of course, patients or patient organizations can also use social media, yeah, to collect money or to draw attention to a certain topic or disease like ALS. This is Bill Gates, by the way, and I'm sure you remember the Ice Bucket Challenge. Well, this is one big social network for doctors. I'm sure Dr. Bart Timmers will elaborate more on this, but I would like to highlight this example because it's a global social network and you can really use it as a doctor to crowdsource a diagnosis or to discuss difficult cases. It's very popular. When you look at healthcare institutions like hospitals, of course, Lee is Ace is the expert, but together with another group in the United States, led by Ed Bennett, we created a hospital social media map. We started in 2011, and we found that, yeah, from 2011 until now, that almost all hospitals started using social media. But what's more important is that they all started using it in an interactive way. So they started to listen to the end users, to patients and their relatives. And based on their experience, they tried to improve their services. Well, of course, then we have the healthcare related research. I am one of the researchers. I really like social networks like Mendeley and ResearchGate to find my colleagues and to find yeah, relevant publications, but there's more. I'd like you to introduce you to Dr. Berto Niebuhr. He's a gynecologist and a researcher from the Netherlands, and he always struggled to find patients, in this case, women with menstrual pain. And with some traditional surveys, he ended up with just a couple of hundred respondents. And he said, we have to do things differently. We will try something new. And by using social media, they disseminated a questionnaire via social media, just in the Netherlands. In a couple of weeks, they had over 44,000 responses. So I think that's a great example of yeah, how powerful social media are. And it's also very yeah, cheap. It didn't cost him anything, just a couple of hours. Researchers also use social media to track the flu. Of course, Dr. Hassan will elaborate more on this, but I would like to share two examples where I was involved. You can download tweets or social media posts, and based on large data sets, you can draw conclusions and you can plot them on a map, like this one. You can see how a disease will spread, for instance. This is another example that we collaborated with the Dutch Healthcare Inspectorate, and we tried to measure the quality of healthcare in the Netherlands via social media. We were successful. We used a social media monitoring tool that will allow you to search numerous social networks, and we found that more likes for a doctor, but also for a hospital, resulted in lower mortality rates. There was a very strong negative correlation. We found the same for other measures of quality, traditional surveys about patient experience, but also more data about infection rates and readmission rates. There was a very strong negative correlation in this case. Then my last example is about bacteria. MRSA can really be a problem. If there's an outbreak, people might die and a lot of people can get sick. So it's really important for healthcare to identify outbreaks. Again, with the same social media tool, we try to identify, we use keywords and we try to identify potential outbreaks. And we compared our findings. As you can see here, we have two peaks, two possible outbreaks of MRSA. We compared this to official data from the government. And we were kind of surprised by the results because we were able to identify an outbreak 48 hours before, so that's 2 days before the official body knew about it. And 2 days in this field, that can really be the difference between life and death. Well, I think there's still a huge gap between what's possible with social media and what's actually been done with social media. So I encourage everybody in healthcare, patients, professionals, and researchers to go out and explore and just, start doing, start trying. Thank you.
Thank you so much, Tom. That was fantastic. So when you have a moment, if you can share your screen, we will transition over to Bart, who will talk to us about what he's doing with social networks.
I'm trying. Where's the meeting? Stop share. Yes.
Okay. I'll share my screen.
Perfect.
You can see it now?
Yep.
Okay. Right. I'm Bart Timmers. Thank you for asking me for joining this conversation. I'm a GP in the Netherlands, and I don't know a lot about social media. Well, a little. But as I said, I'm a GP. I'm very fond of my job, and I am always trying to get better in making healthcare better. And social media was one way to make it better, as I learned in 2009 when I joined Twitter. The things I want to share with you is the use of Twitter in my practice and kind of a special use of it. I want to talk about some other social networks in patient-centered care. There are some examples in my daily practice, and maybe if there's time, I just talk a little about how I try to fight the information overload. There are some useful tools for that, I think. This is my practice in I don't think you can pronounce it, in Serenberg, in near the German border, where I work with 3 colleagues, with 2 other colleagues. I started using Twitter, and the first thing I loved about it was the gathering of information. Some colleagues shared information in a very quick way, and I could ask them questions. For instance, I could ask a foreign doctor, a forensic doctor, some very specific juridic case, and I get an answer in a few minutes. When I started using Twitter, I made an account for my practice, but as you can see, there are not many followers because I started two accounts, one for my practice and one for my private use. And I didn't like, in the first, I didn't like to be followed by patients, but well, the essence of Twitter is open communication, so I had to accept the patients. And well, now it's very normal that they follow me. And as you can see, there are a lot more followers in my private than in the practice account. You get used to that. And at the first moments, it was feeling a little naked, but you get used to that quite soon. As I said, I used it for gathering information, for sharing information, for asking, but also for networking. And it was a great way to improve your network. I was very interested in e-health. And this is the way I got linked, for instance, to Lucien Engelen and to Tom and the REshape. And from that came the TEDx Maastricht, one of the TEDx in the Netherlands about healthcare, which was a great way to meet colleagues with, well, a little bit of the same interests, and so you can use it to grow your network. It even got me a place on television, on the Dutch television, because the network grows, and then there's always someone asking you to join with nice things like a television program on Dutch TV. No, that's for later. I will get back to this now. A very special way to use Twitter was for contact with patients, and I'm not the founder of the tweet spreekuur, the tweet consultation, but there were two colleagues of mine, Bart Brandenburg and Erik Jansen, who started using the tweet spreekuur. And they said, well, all patients from all Netherlands can ask us questions via Twitter. And because I knew them well, I was the first replace doctor on the Twitter consultation. So when they were away on vacation, I did their consultations on Twitter, which was a fun experience. It was a little bit, it was experimenting, because we wanted to see what the use of Twitter could be in healthcare. And well, I think, to be honest, it was a real nice experiment, but to be honest, I think there are better ways to share medical questions than Twitter. But I use Twitter still in my practice, because a lot of my patients, when they have questions after the consultation, they send a direct message to me. Or they send a DM and say, well, just to let you know, everything's working out fine by now. So it's a kind of a short way of telling, well, how they feel and how they react to a therapy. And I like it very much. The only problem is they can send it to when I'm on holiday, but well, that doesn't happen a lot. And well, 9 years from the start, I don't regret making the choice to be that people can connect to me via Twitter. So that's for Twitter. There are a lot of some other patient-centered social networks. This one is called Ozo, and as you can see, it's a network between the patient himself, the client, and his caretaker, or his son or daughter, his family, but also with his pharmacist, his physiotherapist, his doctor, the hospital, all the people who are gathered around the patient, and they can share knowledge and ask questions to the people that has to receive the questions. So it saves telephone calls, and you immediately can connect to the people you want to talk to. That's also earlier, well, about 8 years ago, I did an experimentation with a tool called SWIP. That didn't work out fine, but well, you have to experiment sometimes to find what is working. Ozo is working very well. Another way of using social network professionally is Figure One. I have a line with my dermatologist. I can send them pictures, photos of patients with certain diseases. But Figure One is faster. I did some. I sent some pictures from my patients on Figure One, and I got a lot of answers in 1 hour, and the whole world is watching with you. So Figure One is also a way to share knowledge on a dedicated social network, you could say. In my daily practice, this is an example of what we use in our practice. We have around 19 people well, not all working full time, but we use Slack. We used Yammer before. Now we use Slack for consultations to each other, or just saying things. And as you can see, we have channels. So this is the channel Storingen. If something is not working well, they can put it in here, and well, mostly if it's not working, something with ICT. And as you can imagine, that's the thing I have to do in the practice. But we use Slack for connecting with each other, and that works very well. Another example is this is with a lot of colleagues in my region. We use a special dedicated program for that. We use Harweb. That's a great tool for all GPs in the Netherlands, where they can share thoughts, they can make groups, and they can ask questions. It's highly appreciated by every GP in the Netherlands. And of course, we have things like Threema and CeeLo. I think CeeLo with double I is Dutch, but as you can see here, there's a tele-orthopedy test phase group. There's an enthusiastic orthopedic surgeon who wants to use CeeLo. That's a kind of medical WhatsApp for quick responses for questions from GPs. So if I have a patient with a problem that I want to discuss with an orthopedic surgeon, I can use CeeLo and I get an answer back in 5 minutes. That's what we're experimenting with. And of course, there's LinkedIn. I use that too for sharing knowledge. Just a quick words on how I try to find my way in the information overload. I'm very fond of the use of lists in Twitter. I don't use them all anymore, but I follow around 1,700 people. I can't follow them all daily, so I'm making a list to filter some people, and I'm using a filter on that filter again if I don't have much time to look at Twitter. I'm very sorry, I have to say, I mostly look at the last list because time is running out mostly. But I love the way you can use lists in Twitter to search in a fast way. And there are some other tools I use. I'm fond of Pocket. If you get information on Twitter and you think, well, I want to read that, but I don't have the time, then I put it in Pocket and I can read it later. I'm using the getting things done methods with the information I get. And last but not least, I use a lot of checklists to see if I didn't forget anything at the end of the day, because that's one difficulty in all the social networks. There are a lot of ways you could look at things. Well, this was my story. I hope you liked it. There was a view in a GP's practice and the use of social networks in my daily practice. Thank you for your attention.
Thank you so much, Bart. That was incredible. I love that you're using, you're using Twitter and you're using, Slack for your work. This is pretty cool. I certainly shared it with some of my other colleagues, so this is very, very exciting to hear.
Thank you.
So if you have any questions for either Tom or Bart, please feel free to drop them in the chat box, and the same with Lee and Will, who will be following shortly. So Lee, whenever you're ready, please go ahead and share your screen.
I think I am. Are you seeing it?
Not yet. I'm seeing a blank screen at the moment. There it is.
Okay.
All right.
So now if I try it, are you seeing it now or no?
I am.
Okay, great. Well, thank you. I'm delighted to be able to be with you and give you a little taste of what we're doing at Mayo Clinic in social media and a bit of how we got into it. I would highlight that I've tweeted out the link to these slides, which I have on SlideShare as well. So I'd encourage you to check those out. Many of them have hyperlinks to some of the images and PDFs, so for your reference. So I'll go through these kind of quickly. I know many, if not most or all of you, are familiar with Mayo Clinic and have heard of Mayo Clinic. The U.S. News and World Report magazine does its annual honor roll, and Mayo Clinic consistently shows up toward the top. What I find kind of interesting with that is that if you compare the metropolitan area of Rochester, Minnesota, with the other cities that host one of those top 20 medical centers, we're essentially rounding error compared to those, and which leads to a very large question. And so I have it in very large type. Why would a city that otherwise would be known for the world's largest corncob-shaped water tower have patients come from about 140 countries in every US state every year? The reason is because of social networking. It won't surprise you that I think that's the case, but I want to tell you why. Dr. Will and Dr. Charlie were our founders, Dr. Will and Dr. Charlie Mayo. They had this practice where Dr. Will, the older brother, would travel in the spring because he recognized that in order to provide the best care to every patient, he needed to, as a surgeon, needed to go learn from others, observe them in surgery, and then bring back those practices to Rochester, Minnesota. His brother felt the same. And so he would stay at home in the spring, and then Dr. Will would travel in the spring. In the fall, they'd switch places. I asked our historical unit to give me the list of all the countries that Dr. Will visited in his lifetime, and there is the list. And you'll see that actually
we don't see the list.
You're not seeing the list?
No, we still see your starting slide.
Okay, I think I'm sharing the wrong screen then. So we'll just go through it this way instead of having animations.
Perfect.
Are you seeing this now? Okay,
yes.
Great. Okay, I'm sharing the wrong window. So, so there is the list of those, and you'll see that Holland is included. And this is the map. And what's interesting about that is that Dr. Will visited, Dr. Will died in 1939. And so he was doing this when it was involving train travel and steamship. And so just shows that commitment to outreach. But it was actually a two-way street. It was not just not just visiting others, but inviting others to come and visit them. So they had what they called the Surgeons Club. Between 1908 and 1918, 3,400 physicians traveled to Rochester, Minnesota, which was then population 5,000 people, to observe the Mayo brothers in surgery. And what this really is all about saying is that social networking, the analog face-to-face kind of social networking, is really part of Mayo Clinic's DNA. And it has been part of the DNA of healthcare as well. It's part of just how we operate in the healthcare industry. As we do, and that's more on the professional side. On the patient-related side, as we do research with our people related to Mayo Clinic and their preference for Mayo Clinic, we find that word of mouth is the #1 reason for a preference for Mayo Clinic, or a recommendation from family and friends. News stories would be #2. And the real power of social media is how it combines those. It gives the worldwide reach of media with the power of a personal recommendation. My team has been working since essentially 2008 to move Mayo Clinic from the social networking old-fashioned world to social media, which is just digital amplification of it. In 2007, we launched our first Facebook page, which was a major milestone for us, and then also beginning to use the flip camera, which was an astonishing invention at the time. It has since been eclipsed, certainly by some of the things that you'll see, but the ability to quickly shoot and digitize video and be able to upload it to YouTube, for instance, has been helpful both for amplifying word of mouth, capturing the stories of our patients with their consent, of course, and being able to place that on YouTube and other sites, but also then sharing in-depth knowledge from our medical experts on a topic. And the fact that we can share a relatively extended video that's targeted to, it's self-selected to an audience that's interested. So people who aren't interested don't watch. but those who are interested in getting as much information as they can from a Mayo Clinic subject expert. And because it's on a platform where storage is free and distribution is free, it really can do a lot of good at very low cost. The other side of this is that our patients are on their own social media platforms, and particularly on Facebook, sharing about their experience, which leads their family and friends, their virtual friends anyway, to comment and to share and further spread the word about their experience. This is that acceleration in the video, where previously we had to, the flip camera was a great innovation. Now with Periscope and now Facebook Live, we're able to have live interactive conversations with patients literally all over the world. But we've seen a need also that we want to take full advantage of the networks where so many people already are, but we also want to draw people into a deeper relationship with Mayo Clinic. So we do have a Mayo Clinic Twitter account that has almost 1.9 million followers. We have a Facebook page with something over 1 million followers, and so we're reaching the broad base that way. But the next step that we've taken is to create our own community called Mayo Clinic Connect. It's at connect.mayoclinic.org, and it is hyperlinked from this for you to check out. But it's a community of now about 62,000 people who are patients or prospective patients, people thinking about coming to Mayo Clinic or not thinking about Mayo Clinic, but just wanting to connect with similar diseases and conditions. So this is sort of simulating scrolling down the page. You see that we have people joining in various different groups. We have about 45 different groups, and we create a group when we have a critical mass of those who would be able to be involved in discussions. I don't know that you can see the timestamps that well on that, but the point is that anytime that you visit the front page and you look at the trending discussions, you'll typically find that there have been several discussions happening within the last hour and updated multiple times. So it's become a very thriving committee. I'm now going to simulate scrolling in or clicking into one of those groups. This would be the brain tumor group. A big part that we have is very active community moderation. We have 4 part-time paid staff, as well as a team of almost 20 volunteer mentors who have chosen to give their time to help create a great community experience. And the goal is that nobody's question goes unanswered. It's not that we are there to give medical advice. This is mainly for patients to find support from each other, much as e-patient Dave described with how an online community helped to save his life. The goal is for patients to find support from others. But we also then have an opportunity to inject Mayo Clinic subject expertise into this. So when we do the Facebook Live discussions, we also display them within the online community and get questions both from our Mayo Clinic Connect members as well as those who are watching on Facebook. We've gone beyond this, and this is something that I actually was somewhat inspired to work on when I visited Lucian the last time. Dr. Will and Dr. Charlie had the Surgeons Club where they learned and shared. They learned from others and also then shared what they were learning. And we said there's a place for something like that in healthcare and social media. So we created what's now called the Mayo Clinic Social Media Network. We call it the Surgeons Club for Social Media and Healthcare. So it's a place for us to create resources for our Mayo Clinic's physicians and other staff who want to learn about using social media in clinical practice and education research throughout the organization, but also then to share those resources we've developed with others around the world, and thankful that it literally is around the world in terms of the membership that we've had. The analogy we use is that we're the metaphor, we're the catalyst for social media and healthcare, that we want to help reduce the activation energy by providing resources for our colleagues first inside of Mayo Clinic, but then also externally, and also to learn from them. To develop the best practices and provide good advice to those who are interested in embracing this. So I'd encourage you to go to socialmedia.mayoclinic.org. We have a basic membership which is completely free, which will give you access to many of our resources, and hopefully you'll find those helpful. We also have published some of our again, at no charge, some of the guidelines and documents that we use in consultations with our internal staff, just as a starting point, including social media guidelines that many organizations have used as a way of sort of jump-starting involvement. We've created the first CME accredited online certificate in healthcare. This one's not free, but we worked with Hootsuite to develop that. And that's also available, something that we make available for our premium members, and Hootsuite sells it directly. But then we also have in-person opportunities, much like the Surgeons Club was, where people could get together and learn from each other. These are the ones that we have coming up in June in Rochester. We call it Social Media Residency. It's just like medical residency, only 3 years shorter, and we don't keep you up all night. It's just one day. But then we also have our annual conference in November in Jacksonville, which is beautiful weather, and I encourage you to come and check that out if you would find that interesting. And please do reach out to me on Twitter. I'd be glad to connect with you. And thanks for giving me this opportunity to share what we're doing.
Thank you so very much, Lee. That was amazing. I love your mention around patient communities, because that's one thing, you know, with my some of my Kaiser Permanente colleagues. That's one of the challenges we get asked often is, you know, is an opportunity to build and use an online community, and there's been a lot of back and forth and hesitation. So I'm going to definitely take you up on your list of guidelines and rules and share that with those that's looking to build an online patient community. So thank you.
Great, thanks.
Yeah, I'm really excited. So with that, I'm going to hand things over to Whale. Thank you so much for joining us, and it's all yours.
Thank you so much, everybody, and thanks for the invitation. I really appreciate it. I hope that everybody can see my slides. You should be able to see a sort of a logo with a social media and healthcare. Okay, fantastic. So today I only have a few minutes, and in those few minutes, I want to show you a little bit of a taster on the power of social media and how it affects healthcare. And I'm going to start by saying that why social media? And I think the answer is right there and then. It's simply because it starts with the patients. There's been a lot of research in the last 50 to 100 years about how to improve care. And until, I want to say recently, and with professors like Professor Lushan and others, you know, we've heard the phrases patients first, or patients included, or nurses first, nurses included. The idea is that if we start with the actual people, the real people who need the help, then you get better results. That's why this is so powerful. Now that said, how do we leverage social media? And in my mind, there are a few cases that social media can be leveraged. Number one, and the easy one, is you can think about, you know, reporting and how it can be used for reporting and how you can produce a very nicely looking report. The second aspect is around monitoring, and that is really particularly monitoring for any specific diseases or any mentions of diseases and whatnot, and that you can correlate to any other data, such as the hospital data or the ministry data. You can do analytics, and obviously that's also very powerful in terms of trying to create correlations. I think that's really very, very important. Now, when it comes to reacting and responding, and you'll see those two aspects, that's when it gets to what we call health surveillance. And in the ministries of health across the world, they have a unit in which they either react or respond, either actively to a sort of an outbreak or a disease, or passively to a misconception or lack of understanding around vaccination. Okay. And then finally, and very important, is the ability to query, to find out what's going on in the world or in the country that we live in, right? Social media is very powerful because it's the largest unsolicited storage of information. Any such query on the internet that goes through Twitter, Facebook, and other social media comes back with around 1 trillion posts. So if you are serious about social media, there's a lot of data, and there is, in a sense, too much data. So sifting through that data is going to be a challenge. And then companies like ours and myself, we help clients do that. To make it real, in the next slide, I'm going to, if this moves, I'm going to talk about a few use cases. In the first use case, we actually use social media for privacy purposes. How do we do that? Hospitals across the world, they have a so-called a permissive system, which means that anybody within a hospital boundary or even a clinic boundaries can look up any patient information. And the more important that patient is, the more curious people get about them. So what we do is we actually help hospitals by providing the influence score or the power of a social media influence score to the hospital audit system, and that allows the hospital to easily identify and protect who are the persons of interest. That's really it's a new feature, and it's not, you know, not many companies are doing it, but I think companies or hospitals that are serious about protecting people's privacy, they use the influence as a factor to understand, you know, will this person create a curiosity, and will people in the hospital go and look up their profile once they come to the hospital. The second one, the second use case I'm going to talk about today, excuse me, it's about studying population health. As you know, population health research centers in every country do exist in the US, Canada, and in the EU. There's research centers across the board. Now, truth is that people are volunteering every day their symptoms online. And I specifically mentioned the word symptoms because I don't want to talk about disease. Because a lot of people, what they experience is what they think they're feeling rather than what's wrong with them. So if you're doing a study on a particular virus, people may not know what it's called, but they will talk about its symptoms. And that's why it is so powerful. And there's so much data. So much data, it's unbelievable. The third example I'm going to talk about is really around understanding the misconceptions out there. In the US and Canada these days, as a case in point, there is a major push by, I don't know, I think call them bloggers or call them people who are interested in the what's so-called alternative medicine. They're promoting that vaccination is actually not good for you. In fact, they have, in a sense, fake testimonials from doctors. They have what they call evidence to promote the fact that, well, you don't need to vaccinate your kids because it's going to cause autism. That's a serious concern because unvaccinated children in a modern country like Canada or the US or the EU is a serious problem because, as you guys are all experts and you know, that will cost the health system a lot of money and it will damage the lives of these families. So getting ahead of that, understanding from a ministry perspective or the government perspective, understanding what is the message that's being used on social media, what kind of articles are there, and preparing content and respond to it either actively or passively to dispel the myths around the negative issues of vaccination. This is a very, very serious topic, and at least the Canadian government is taking it very seriously, and they are looking at social media as a major source of data for that. The fourth case, which our colleagues earlier spoke about, which is monitor for any outbreaks. Again, like I said earlier, about you know, any specific disease or a viral infection and whatnot. I think that's also provided. So that's another value add. And the last two, you know, as I mentioned earlier, is, you know, the ability to provide analytics and understand the correlations. And in my demo, I'll show you a little bit of that, I think, just to give you a taste. And finally, to act as a life study. And for people, and what I mean by that is that for people who participated in health data research, you know how difficult it is to get a study group with a researcher or a group of researchers, a goal, a control group, and a test group. That process is very expensive and it takes a long time. So you could technically use the internet to see or to correlate, to create correlations on a live study, right? It won't have the same discipline and rules as a normal research study, but it has at least the power of reaching out, like Tom mentioned earlier, it has the power to reach thousands, if not even millions. So those are some real use cases that I wanted to talk to you about today before I jump to my demo. Now, having said all of these, before I jump in, there is there's a social and a human aspect that comes with responsibility. When you have that much power, which is equated to a lot of data, then you got to act responsibly. Whoever is wanting to do this, I think you need to ensure you have a data protection officer or a privacy officer, not a lawyer, and I'm very specific with that, because you should be really concerned not only with protecting yourself as a company, but also with actually people and what they're thinking in the outside world. What would they feel if their use case is published on the internet as a case study without them knowing? So it's really important to involve your privacy officer. If you're doing research, go through your research committee, just like as if it's a normal sort of a hospital research. And then if you want to publish anonymized data. So with these three rules, I would say, I think work cautiously. It's very powerful. And now I'm going to jump into the live demonstration that I've prepared for you.
Well, that sounds great.
Great. Thank you so much. All right. So what we're showing you is what we call KI Social, which is our tool that is allowed to, it actually has access to full Twitter data, all the public information in Facebook, all in public information that's available on YouTube, Instagram, Google+. You can see the list of sources that we've prepared here down below. Okay. And through this query in front of you, we basically ran a query to look for all these terms on the network, okay? And we limited to only a few days because we actually got way too many posts. So it's only limited to 4 days, but it has a lot of data, right? So what we're able to do here is that we just ran a query. For a lot of them are either symptoms or problems that we expect that people will be talking about. And as a researcher, you don't want to think about the technical medical term. You want to think about what people call it. And that's the kind of query that you want to create. You take that data, and then you can start by clicking on these on this dashboard. Then you can see various affinities, which means this is what people, this is, by the way, it's localized to the United States. So it's going to tell you, this query will tell you, with these posters, the people that posted about that data, what do they care about? What are their affinities? I think that's an interesting diagram. You can and look at various outlets, and you can see different names that you may recognize or various words that they use. It could be the social club. It could be their interest in music and whatnot. This gives you a sort of an idea of what they care about. All this data, by the way, is exported. Then you can look at word clouds. Again, a lot of people, well, I think some people have a love-hate relationship with word clouds. They provide you with some interesting information, but people may argue that that they may not be terribly useful. However, it does. Oh, getting a page crash. Sorry about that. But it does definitely provide you an idea of what we care about. Just got to give it about a minute to respond. Of course, anything that can go wrong will go wrong in the demo. Sorry about that. I'm going to open a different browser just to make sure that this is not a...
Well, we have about a minute or so before the top of the hour. If this is going to, if we're running into a technical glitch, what we can always do is have people continue this conversation with you on Twitter and continue with a demo. I just want to give you the option.
And I appreciate that. I think I'm going to go back to sort of my slides and talk about this a little bit more, because I think for some reason, the web page is not responding. But the idea is that we were able to, and I'm going to summarize it verbally, and you guys please follow up with me after if you like. So we were able to correlate pain with what sources of pain. So you can tell what people are feeling, like how many people, first of all, in the population, on the media are talking about pain, what kind of pain it is. And we've discovered, for example, that back pain is one of the most serious problems that people talk about the internet. The second observation that we've had is that a lot of people talk about mental issues online, a lot more than any other disease. People are willing to disclose their mental health or their sadness, their emotions, or challenges that they're facing from a sort of a mental health perspective. People are disclosing things about viral infections, about foot pain, about how they feel, about you know, the impact of alcohol. So there's anything you can imagine as a subtopic of from a public health perspective or from a clinical perspective is being posted on social media, and it's all that data is available to be processed, correlated, and co-linked. And I want to, the last 10 seconds, I want to talk about our experience where we're doing this with real clients, is that we are working with the federal government, and in which right now we're working on social media in marine life and how it's affecting people who care about the marine life world. We're working on infrastructure projects in which we want to understand the people's impact of transportation and major projects and how it affects people's lives. And then the third project is around healthcare, which is how do we deal with misconceptions of vaccination, and that's a real huge topic. So in summary, social media is extremely powerful. It can be linked wisely and in a protective way from a privacy standpoint to your corporate source of data, and it can provide great results. Thank you again for having me for this hour, and I appreciate your time. Thank you.
Thank you so much, Will. That was fantastic. I love the use cases you've outlined, and we will definitely, ask everyone to check out your what you're doing and start to follow you, so we can learn more about your progress and the amazing work that you've embarked on. So we are at the top of the hour, so I do want to hand the session back to Cynthia. It looks like we're out of time for Q&A. However, since we're talking about social networks, I think it's very fitting that we're going to ask if you have any questions for the speakers. Feel free to take to the Twitter sphere and to other social networks and get in touch with the speakers and continue the conversations there. So with that, Cynthia, I'm going to hand things back to you.
Great. Just a quick reminder that today's session was recorded and will be available on our member site, so please check out members.iln.org. And if you would like to forward questions to the presenters, again, Twitter is a good way to go. You are also welcome to forward them to Gloria Zions. That's gloria.zions@iln.org. Thank you so much for joining us. Have a wonderful Tuesday.
Thanks, everyone. Bye now.
Thank you. Really glad to be with you.